And there we go, the anesthesiologist said warmly. You're going to start feeling really sleepy. Don't try to fight it. The drug will keep you nice and still. In a moment, I'll release the IV, and that'll put you completely under. The room felt cool and sterile. The overhead lights were harsh, almost surgical in their brightness. Under any other circumstances, falling asleep here would be impossible. But with the first stage sedation, as they called it, my whole body felt like it was wrapped in warm cotton. I could still hear things. The faint beeping of a monitor, the soft hum of the vents, the occasional murmur of voices. But none of it seemed to matter. My arms were heavy, my legs heavier still. The IV line tugging gently at my wrist was the only thing that reminded me I was still tethered to the world. I wasn't fully under yet, just relaxed. More relaxed than I'd ever felt in my life, almost dreamlike. But I still knew who I was, Levi Caspin. 25, here for a minor procedure. Nothing serious. There had been a brief delay before prep. A nurse had mentioned a mild reaction to the IV antibiotic, a slight puffiness in the face, maybe a little discoloration. They kept an eye on it, noted it in my file, but said it wasn't uncommon. Nothing to worry about. Because the area they needed access to was my upper chest, they'd already placed a full sterile drape over most of my body, including a translucent surgical hood over my head. It was part of the oxygen delivery system, like a CPAP helmet, to keep my airway stable through sedation. The anesthesiologist had explained the need for the hood, but all I caught was that I'll feel like a spaceman. From the outside, I could imagine I looked like a blurry mannequin under plastic. The hood fogged a little as I exhaled, blurring everything further. My hair was tucked away beneath a surgical cap. My features, not that I had especially distinct ones to begin with, were hidden under the haze. God, I can't wait to hit the beach again. It was time. The anesthesiologist had his hand on the little IV release, telling me to get ready to count back from 10. 10, 9. The door opened with a hiss, and a new voice cut in, startled, loud. Hey guys, stop, stop, stop. You've got the wrong room. This one's ours. Seriously. I was a second away from lights out. The surgical team turned to the source of the interruption. It was an orderly in teal scrubs, badge clipped crookedly to his collar, waving a clipboard. I could still move my eyes at least. I shifted my gaze to see them gathering around him, voices rising in hushed urgency. They were definitely talking about me. Hey Levi, that was the lead surgeon, suddenly appearing in my peripheral vision. He looked mildly frazzled, like he'd jogged over. So, quick update, he said with that practiced, reassuring tone. I blinked slowly up at him. No worries or anything, he went on. Just a slight delay. Another case got bumped up to this, or it's complicated, kind of a rush. So they're going to shift you downstairs to OR7. They'll start prepping that room right away and page us when you're set up. We'll probably start on you in an hour, 2 tops. His voice was gentle, calm. He had the smile of someone who explained things to groggy patients every day. Behind him, a nurse stepped in and began unhooking the IV ports from the wall and attaching them to a rolling stand. We'll get you settled in no time, she said with a cheerful nod. Or 7's quieter anyway. Less foot traffic. Might even be better for you. I tried to nod. Maybe I did. My neck felt like it had a sandbag tied to it. The anesthesiologist returned to my side. Mr. Caspin, I'd rather not bring you all the way back up just to put you under again. Just relax, and I'll top you up until we're ready. Just get comfortable and have a pleasant nap during your procedure. Another nurse placed a warm blanket over me, smoothing it down gently. An orderly will be here in a few to wheel you to pre-op until OR7 is ready, she added, giving the bed a reassuring pat. You're doing great, hun. Just relax, go to sleep. You'll wake up a new man. The two of them turned and walked out, their voices fading into the hallway. Nothing's wrong, just a different room. My surgery's just delayed. That's all. The IV pump clicked beside me. My eyes fluttered closed. Someone will come soon. Everything is fine. Awaken wrong team something felt off. How long was I out? I blinked up at the ceiling, blurry shapes above me shifting as I tried to make them out in the fog of the hood. They appeared to be the same ceiling tiles, same fluorescent glow. The room hadn't changed. So they didn't move me. My thoughts felt syrupy and slow, floating around in a chemical fog. I tried to lift my head, but it lolled uselessly to the side. I could move my eyes at least. The door was still closed. Had they forgotten about me? The door burst open. A group in fresh scrubs swept into the room like a storm. There were maybe 5, 6 people. A nurse in maroon led the charge, followed by a younger man with an equipment tray, and two others I couldn't see clearly from my angle. Definitely not the same staff from before, they sounded different. The lead nurse scanned the chart on her tablet. "Damn, she beat us here," she said, her smile fading. "And they just left her here? She's not even plugged in." "Yeah," said another voice, barely glancing at me. "They said she'd just been sedated upstairs and moved down. Guess she didn't want to risk waking up between floors. And they never said anything about a sedation hood." "She?" I blinked hard. Another nurse walked past the foot of the bed, plugged in the machines, and started checking the readouts. "It's fine, we'll switch to the mask once we start working on her face. Vitals are stable anyways," she murmured. "Sedation meds are holding. Looks like they just started the first round." "Perfect," said the lead. "We'll keep her under until we're ready. Better for everyone." I tried to move. My hand, my foot, anything. My limbs were dead weight. My lips parted slightly, but my tongue stuck to the roof of my mouth like old glue. "She looks bigger than I expected," someone said offhandedly. "Wasn't she shorter on her intake?" "Might have been a typo," someone else shrugged. "Chart says 5'5", but she looks closer to 5'8". "Don't forget she's lying down right now. It changes the perspective." They were looking at me, but not seeing me. Not really. No one had said my name. "Don't you want to double-check something?" "I'm not she. You've got the wrong patient." But no one checked. No one paused. They moved like clockwork, confident and casual. "Okay," said the maroon scrub nurse, eyes still on the tablet. "Let's get started on prep." "Started? Prep for what?" I couldn't speak. I couldn't sit up. I was drowning in my own skin. I can barely keep my eyes open. It's going to be awfully awkward when they find out I'm a man. But still someone has to notice eventually, right? That it'll all stop before anything serious happens? Surely, once they see I'm a man, they'd realise something was very, very wrong, wouldn't they? Near miss crap, I nodded off. The world tilted gently, rocking like a boat. Everything felt too bright and too far away. My skin was warm from inside, as if the drugs had sunk deeper. I couldn't tell how much time had passed. They were still bustling around me, voices floating in and out like I was listening through water. Metal clinked on metal. A cool cloth brushed my throat. I was being wiped down, prepped. "Did she not shave?" one of the nurses remarked. "I'm not the hairiest guy out there, but shouldn't that be a clue?" And yet still no one said my name. Someone needs to check. They always check. A nurse walked past my head with a chart in hand. It was a real clipboard this time, not just a tablet. She stopped near another colleague, flipping through pages. "Okay, just doing a final ID check," she said, voice cheery. "Let's confirm we have El Casper, right?" My heart stuttered. That was close, but that wasn't me. My name was Levi Caspen, not Casper. So close, so close. "El Casper," the nurse continued, glancing down. "DOB, October, hey Jenna." Someone called out across the room. "Need a hand with the tubing." The nurse flinched, looked up. "Coming." "I'll finish this after," she said, already moving. She set the clipboard down on a tray and walked off. Didn't finish the birth date. Didn't say the full name. Just El Casper. October something. My birthday was October too. Oh God. "You didn't finish. Read the damn chart. You have the wrong person." I tried to move again. Just a finger. Just a toe. Anything. My body didn't belong to me anymore. The anesthesiologist came closer. Different guy. Adjusted a dial. Made a note. "I'm going to run upstairs to OR2. I'll be right back," he said. A second nurse was shaving my chest now. Their voices kept floating around me, light and unconcerned. "She's got nice skin," someone said. "Smooth. We won't have any trouble." "I don't have boobs. I'm obviously not this woman you think I am. Why can't you see?" "This one's getting the works, huh?" Another voice asked, half joking. No one answered. The implication hung in the air. Whatever she was here for, it wasn't small. I felt the panic rise behind my ribs, thick and hollow. My eyes watered from the strain of staying awake. I was slipping, and I knew it, but I still had hope. They have to notice that I'm a man. They'll stop when they realise. They have to, right? The works I have to stay awake. Everything felt dimmer every time I awoke. The sounds were softer. My thoughts were scattered, looping over themselves, skipping like a scratched record. I could barely keep my eyes open, but I had to. Every time they drifted shut, a fresh wave of dread surged through me. This isn't right. They still hadn't noticed. But they'd notice soon. They had to, because the surgeon leading the surgery wasn't here yet. Heads are going to roll once they realise they got the wrong woman. There was a warm chuckle near my feet. My gown was being lifted. Whatever prep they were doing was now approaching my genitals. Once they see my dick, they'll have to know that I'm a man. But instead of shock, There was a laugh. Oh Lord, she's packing all right, a nurse said, lifting the blanket briefly. Right? Someone else replied with a laugh. Seems such a waste to make that into an innie? What? You know I have a penis, no breasts, why aren't you stopping? I'm clearly a man. And then, the surgical lead entered. A female this time. She entered the room with a kind of quiet authority. Tall, elegant, silver-grey streak in her ponytail. Eyes sharp over her surgical mask. Everyone stopped what they were doing when she arrived. About time. Surely she has to realise I'm the wrong patient. Why the hell is she in a sedation hood? The surgeon snapped. I don't know. Prep team didn't mention it. Didn't even prep her yet, before they punted her here, one of the nurses responded. But we just finished prepping her, and we'll have Dr. Zuli switch to the traditional mask system before Dr. McAllister comes in to do her face. God, prep team has been slipping. All right then, let's go through it, she said, snapping on gloves. No mistakes. Today's a milestone day for our patient, so I want everything smooth and by the book. She glanced at the clipboard, then at the monitor, then at me. Patient is Lena Casper, age 25, undergoing full gender confirmation surgery. Primary and secondary feminization procedures. What? We'll begin with bilateral orchidectomy and penectomy. I want clean lines, minimal trauma, then vaginoplasty, standard depth. After that, we'll move to facial contouring. The usual, jaw reduction, trach shave, minor rhinoplasty, brow lift, and orbital shave. The room was quiet except for the occasional scribble of notes. I couldn't breathe. Breast augmentation is last. 500cc implants, submuscular placement, everything's signed and authorized. She's coming in as a Buick and leaving as a Porsche. No, there wasn't any misunderstanding. They weren't confused. They knew I was male. They expected it. Every step was mapped out, practiced, anticipated. There wasn't going to be a sudden gasp, a wait. This isn't the right patient. This was the plan. Where the hell is the anesthesiologist? Stage 2 of anesthesia in 3 minutes, people, the lead barked. Let's give her a dream body she'll wake up proud of. My world narrowed into a tunnel. They weren't going to stop. They were going to do it. And I couldn't move, couldn't scream, couldn't even blink fast enough to signal please look again. I'm Levi Caspin. I'm not L. Casper, but it didn't matter anymore. A reprieve silence. Warm. Still. And then light. My eyes fluttered open. My body was still lead, but the blur above me swam back into focus. Same sterile white ceiling. Same humming lights. My mouth was dry, tongue thick, but I was awake. I'm still here. I'm still a man. They didn't start. I could have cried if I had the strength. Voices. Familiar but sharper now. The lead was speaking again. Now rather irritated. More so than normal. Where the hell is Dr. Zuli? He was supposed to start anesthesia 5 minutes ago. Still hasn't responded to the page, someone answered. Want me to try again? Yes. Again. We're falling behind. I could almost feel my heart trying to fight its way out of my chest. This was it. This was my window. They couldn't start without anesthesia, and finally they might look closer. The lead surgeon stepped closer to me. I felt the shadow of her presence, sensed her eyes on my face. Then she frowned. She looks different. She leaned closer, her jaws more pronounced than I remember, heavier, and the shoulders. Are you sure this is Lena? My heart soared. Yes. Keep looking. Say it. You're so close. A nurse slid up beside her, voice soft but firm. Dr. Lind, please be careful, she said. Remember what happened the first time you met her? Passing is everything to her. She's impatient, couldn't even wait for the hormones to do their thing. The lead hesitated. I saw it. I know. Just something feels off. You're just noticing the sedation swelling, the nurse said quickly. Some patients puff a little. It'll fade. The lead exhaled, glancing down at the chart again. Maybe. I just swear she looked more feminine in pre-op. I tried. God, I tried. If I could have twitched a finger, rolled my head, anything, but I couldn't even raise my hand. All I could do was listen as doubt flickered. Then world started to dim again. No, stay awake, she has to see. Another nurse passed by the foot of the bed. Anyone notice her hands? She asked. Kind of big. Like, really big. A chuckle from someone else. She's probably self-conscious about them already. Don't pile on. No, seriously, look at the knuckles. And those feet. If I didn't know better. More laughter. Light. Friendly. Unthinking. The lead rubbed her temple. Okay, enough. Let's stay professional. This is a vulnerable moment for our patient, and I won't tolerate any shaming. If we've got real concerns, speak now. I do. I have concerns. You got the wrong patient. Silence. No one did. Of course no one did. The monitor beeped softly. The IV hissed. My body betrayed me with every second I stayed still, unable to scream, unable to argue. And then I heard it. Paging Dr. Zuli 2 or 3. Dr. Zuli, please report 2 or 3. No. Time was almost up. I was still here, awake, conscious. But every warning sign, every gut feeling, every truth seemed to have been explained away, repackaged as sensitivity, as progress, as compassion. Please, please, you have the wrong patient. Last chance the lead surgeon turned toward the nurse, the one called Jenna. She was still fighting the last remnants of suspicion. Jenna, just to be clear, you double-checked the patient identity before we prepped, right? Jenna barely looked up, distracted as she adjusted the IV at my side. Yeah, I did. I paged him twice already. No hesitation, no concern. No, she didn't answer the right question. She didn't double-check me. The lead nodded. Good. Just wanted to be sure. That was it. No, they think they're sure. They just assumed. And now they were moving on. Someone pulled back the sheet again. She's taller than I expected. Another nurse muttered. A tech laughed. Nobody's honest on those intake forms. You think this one rounded her weight down too? Pfft, of course she did. Who doesn't? The lead rolled her eyes but with a smirk. Well, she's here now. Let's give her the dream body she's fighting for. A nurse chimed in, a bit more quietly. She's a fighter, all right. Heard her daddy has deep pockets. Or was it her blog sponsor? She also kicked up such a fuss to get herself fast-tracked. Couldn't even wait the full year of transition. Another replied. Didn't even wait for full hormone effects. Said she was tired of the in-between stage and just wanted to be done. One of those straight-to-the-finish-line cases. The room nodded like it made sense. Like that explained everything. No. They had answers for all of it. My height? Just a fib. My shoulders? Early transition. My genitals? Exactly what they were expecting. And none of them had read my full name. Almost none of them had seen my face before this room. None of them knew I was Levi Caspen. That I'm here for a minor lump removal. Not this. I'm running out of time. The anesthesiologist was going to be back any minute. Time's up. A sharp clatter jolted me from the fog. Shit, I drifted off again. Somewhere beside me. My vision swam, then sharpened just enough to see what had landed on the tray beside me. 2 semi-translucent gel-filled sacs. My stomach lurched. I knew exactly what they were. Implants. They glistened faintly in the sterile light, humming with quiet finality. Wow, talk about an upgrade. She's going from 0 to double Ds just like that. Her poor back gonna feel those new puppies, a nurse commented. The lead moved to my chest. I couldn't feel her touch, but I saw the black marker in her hand, saw the steady, practiced motion as she drew dotted lines across my skin. Her brows furrowed. She hesitated. Just for a second, there was something in her eyes, a flicker, like a puzzle piece she couldn't quite place. She stared at my face, my chest, then back to the chart in her hand. Wait a second, she muttered. That's right, you know it, you got the wrong person. But before she could finish the thought, before she could even ask, the door burst open. Sorry, I'm late. Dr. Zuli's voice rang out, bright and unfazed. There was a complication or 6 that I got dragged into. Downstairs is a mess right now too. Can you believe that they're missing a patient? Yes, me! The missing patient is me! He was already slipping on gloves, moving with swift precision. The team made space for him like clockwork. The lead blinked, her doubts scattered like dust in a gust of wind. She stepped aside. No, you were so close, please, stop this. We're already prepped, she said, masking the unease. Let's begin. Dr. Zuli gave me a calm, reassuring smile. You're gonna do great, he said gently. He flicked the dial on my IV, and another dial that led to my hood. I tried to move. No, don't do this, you got the wrong guy. I willed my blood to stop moving while I held my breath, but my lungs betrayed me. The hiss of the gas was soft, soothing, almost. The edges of the world curled inward. No, please. You got the wrong person. I'm not her. I'm not. My thoughts scattered like feathers in wind. The Dr. Lind picked up a scalpel and headed around towards my legs, to my exposed penis. Darkness bloomed behind my eyes. Please, I don't want to be a woman.